My name is Jama. I go by Jet. My pronouns are they, them, theirs. I am the Community Health and Wellness Coordinator at ETSS, and I am a part of the Central Ohio Pathways Hub.
My name is Mary Peavy. I am a community health worker. I'm one of the team leads at ProMedica, Toledo Children's Hospital. And I'm a part of Northwest Ohio's Pathway Hub here in Toledo, Ohio.
So I chose to become a CHW for a few reasons. The first is just my personal experience. I Around 2021, I had my own personal health, diagnosis, and I was by myself navigating the health field and just trying to find my own resources. And that really, made me want to do this work and help other people that might be in the situation, like the same situation or similar situation to me, where they don't have anybody to lean on or anybody to ask for support or help. And I know that's what CHWs do. I know helping is important and, change is good. And I want to be a CHW, especially at this time when a lot is happening.
I believe I am a CHW because I wanted to have the ability to empower my community and make it stronger. I have always been a CHW. I feel like at heart, when they created this position, it just was like the right title at the right time for me, for the things that I was doing already in my community. A lot of times I find that CHWs are already doing the work. It's just that they created this title and we were able to tie everything in together and able to do the job that we're doing now. I would say it's my ability to listen to my client and then to also hear the things that they are not saying when I'm meeting with them. And then create like a healthcare plan based on those solutions that we come up with together. I also think that I have ability to collaborate like community resources and tying that into the healthcare piece. I like doing that because it gives us the ability to use those resources that lie within our community. And it also gives them data so that they can continue the programs and receive the grants that helps build our community and make it stronger.
I feel like this job comes naturally to me. And also, I would say my emotional intelligence. I'll expand on the first part a bit more. I had a meeting with one of my academic mentors. Her name is Dr. Daly, right before I joined ETSS. And when I told her I was getting into, the you know, community work field and public health field, she said she knew that would be my place to shine. I guess she also saw that it came naturally to me helping people. I've done it since I was small, whether it was helping my, you know, parents or my uncles and aunts or my grandparents translate things, help fill out forms, helping people, helping the climate. I've just always wanted to help people. It just comes easily to me. What really excites me about being a CHW is the impact. So I'll just go a bit into my role at ETSS. As the Community Health and Wellness Coordinator, it's my job to like basically help the community the best I can. And I we're just currently wrapping up a community health needs assessment with the Ohio Department of Mental Health and Addiction Services and Miami University, which includes 5 communities, including the community that I represent, the Somali community. And it was just to try to see what the communities need. We worked with 5 communities and we worked with community leaders so that it could be community led. And just seeing the impactful work and just seeing, front lines, the work I'm doing and how it's helping people has been really amazing and really, just honoring and I feel blessed. Um, and then in the future, I would say I want to see CHWs be the bridge um, that that basically mends or covers the gaps in healthcare, whether it's because there's a lack of like language services or class services, um, or anything. I just want to see CHWs in the center and helping and leading. And I feel like, especially as I said mentioned earlier, times are changing. And I feel like CHWs, especially those that represent the community and that are working in those communities, can help the community, move along and become stronger.
I think the thing that's exciting me most right now is that I see that the field is growing. Um, I feel like it started off kind of slow, but as the years have progressed, and then the knowledge of the community health worker into so many different healthcare settings has allowed us to be used in many different ways. You can see us being used in physicians' offices, dental clinics, at churches, community centers. And I think that our work is not going unnoticed. My hope is that at large, that our profession will be incorporated into like discharge rounds in the healthcare. And we'll be seeing just like RNs, social workers in the healthcare force, LPNs, will just be another credential um, that will be seen when people are using their healthcare, and they'll all already know our profession. It definitely has changed. I feel like the work that CHWs do changed during the epidemic due to like the many different needs that people had in our community. At that time, they were mostly closed within their own homes and still relied on some of those resources and needed those connections. And that's where we came in. I think that with us doing the CDC educations and the opportunities that you allowed us to get doing this with the current information that was relayed to us as community health workers, it was allowing us to better serve our clients and make sure that we were able to give them current and knowledgeable information. I have used the EMT tool to identify areas where I can bridge some of those gaps for the clients in the community I serve. The way that I use the tool, I'll go in and look at what identifiers such as like churches, community areas, clinics, churches, food pantries, those type of things are where I'm able to connect with more community members and I'm able to educate them as well. I have found that food clinics are like the number one resource for me. A lot of time people are waiting in line or maybe sitting waiting for their number to be called. And that's a perfect opportunity for me to educate them, give them resources, provide them flyers, give them other connections to other things in our community that they have no knowledge even exists. A lot of times it is just providing that information on so that they can educate their family members as well as their neighbors as well.
I don't think anybody really knew what was going on in the beginning of the pandemic. And it just kind of felt like everybody was rushing. There's a lot of stigma, there was a lot of misinformation, there's just so much going on. And the trainings for sure really helped. They were very informative, educational, and they really basically explained things to me so that I could put it in other words and explain it to other people. Um, I studied, biology too, and I know I understand the importance of, translating science. And a lot of the time, I don't think a lot of scientists do that. So it's really important to like have somebody there that can, let's say a health expert or a scientist can relay that information to, and they can take that information back to their community and put it in a way that makes sense to their community. But I would say the pandemic really motivated me. I thrive in challenges. I don't know why, but I thrive in challenges, and just that, like, just the next challenge and having to push through it, and being here today, and seeing the impact that the work that CHWs have done to build the community resilience has been really helpful and impactful. So I already mentioned, misinformation. There was also fear. There's fear about the vaccines, the side effects that they might have. Also, that fear came from the misinformation. And then there's also Black, Indigenous people of color. They were having challenges in getting vaccinated. And one way that ETSS supported in that was hosting vaccine clinics with FCPH and Columbus Public Health. And I really liked how they made it incentivized those vaccines, because that really, motivated people to get vaccinated. There's concerns over the ingredients. As I said, there's not a lot of scientific communication. So I feel like we definitely need to work on that, translate science into a way that people can understand. I feel like science is for the benefit of community, and hence should be understood by the community. There's also a lot of equity issues. Immigrants and refugees face, big hurdles like language barriers, and there's not a lot of resources and flyers or any tips that were translated. I know ETS has supported in that by translating flyers into multiple languages and posting it into our social media accounts. And then there's just a lack of trust and a lack of access. Depending on where you live, the nearest vaccine clinic is, very far away. And if you are a mother with a large family, you don't have time to take the bus or, request a babysitter or something. So there's just a lot of challenges. And I really wanted to highlight something that, the CEO of ETSS did, Dr. Saleshi. He made a video of he was getting vaccinated, and he made a video and posted it. And that showed people that it's not like the misinformation was false, it's okay, it's safe. And I feel like that really was really helpful. And also the class education that ETSS did was really helpful.
I think people still lack reliable information that they have access to. It is important, I think, that as CHWs that we educate and spread knowledge so that our clients can educate their family, their neighborhood, and, like I say, the community at large. I know that there are still barriers, because if there weren't still barriers, we would not be seeing some of the rise of, like, the infant mortality. That wouldn't be so it wouldn't be still rising at this point. So there's still a lack of education in regards to some things. Um, but I think those barriers can be seen. They're relevant in the healthcare that we're doing, and it's just seen in the overall outcomes. Um, Especially you see it in, like, impoverished neighborhoods. But I think that the work that the CHW is doing, we are helping battle those odds. We are increasing the people's knowledge in those areas so that they feel more empowered when they go to the doctor's office. They realize that they can advocate for themselves, and they know they can be heard. I think them being able to use their voice is the most powerful thing that they could have. A lot of times they didn't feel, I think prior to the CHW, a lot of people didn't have a voice. Now they do. I feel that the work that the community health worker is doing affects community resiliency because the work that we do, like I say, educates clients, it spreads knowledge within our community, and it helps them to advocate for themselves and become educated. Um, it could be as much as us providing them a community referral to a community care hub. They might be able to obtain an STNA certification, which could increase their income level in the home. It could be as much as them obtaining their GED, something that they didn't have the opportunity to do when they were younger. It also could be them just becoming more health aware about like the food they eat and how it affects their overall health care. They might attend maybe a healthy cooking class, or they could become more financially educated by even getting a connection to a financial counselor, which still all of those things between the food, health, and then also from the education, which was increasing their income altogether. All of those things incorporate our community at large and helps build resiliency within our community. I think the biggest hope is that with those things that we teach our clients, that they're able to teach their family members and those ones that come after us, because there's no way that a community health worker can be in every situation. So our clients have the opportunity to learn from us, and then in turn, they teach the people that they're around. And then it all comes full circle. I believe we all have a job to do. And I think it's just spreading that and making sure that everybody is able to I feel as though that everybody is able to be a teacher, no matter where you come from. We all learn. We all had the opportunity to learn every day. And that even with us learning, um, every day can be a new challenge and a new way of doing things. I feel like the outcomes that we are having now in our society are as a result of having the community health workers, even during the epidemic, during COVID, and the knowledge that we were able to acquire during that time, even with like the CDC and then the CU educations that we were able to receive through our hubs. I feel like with that information, it has allowed us to hopefully bridge, and it seems like to me like we've bridged some of those outcomes for our community. And I think that we can only build from where we're at and just continue to go beyond. I think we're just on the forefront of doing something that's going to be awesome and great. And I think that it can only get bigger. I just truly do. I believe it can only get bigger.
So there's a few things. So resilience, I first want to like talk about what resilience means to me. I see myself as a very highly resilient person. I've been through a lot. If I shared my life story, we would probably all be in tears right now. But I'm here today, and I think sometime last year, I was kind of iffy about the word resilient, because I had seen somebody say resilience does not mean you can throw anything at me and I'll just bounce back, right? And so, and I feel like that's like a problem, right? So like for me, what I see resilience as is having the will, right, to overcome. That's what I see as resilience. I've been through a lot, as I said, and just having that will to keep moving forward and to keep pushing through and knowing that things get easier has really shown me what resilience is. And it doesn't mean that everybody can just throw anything at me and I'll just bounce right back. No, it means I'll set my boundaries and and I'll keep pushing forward and I'll keep moving forward. Um, and I already addressed, promoting class in education, because that's how you build resilience. Having the will. I know there's a saying that says, if you have the will, you have the way. And that might not always be accurate, because some people have the will, but they don't have the resources, or they don't have the literacy. And so just providing, promoting health education in class and health literacy, and also strengthening community networks, building stronger communities helps with resilience. And I also really wanted to talk about just the impact, or the importance of community resilience. At the beginning, I talked about, changing times. I know a lot of us have heard about AI. So, acknowledging climate change, the COVID-19 pandemic, AI, it's just all the war and everything that we're seeing today. It's really, really important to build community resilience, so that the community can keep moving forward and no community is left behind.